Hi everyone. It's Chris Jackson here, Medical Director of the Cancer Society. I'm not sure if you can see me or not. This is the very first time I've ever used Facebook Live, so I hope it's working for you. Kia ora koutou, I'm going to try and take the dazzle out of that too. Nice to see everyone here. Well, I'm not seeing anyone here, I'm seeing myself. This is very disconcerting. I've never done this before. Hopefully someone will text me and tell me that it's working at the moment. It's G'day, I've got some people there. Great. It's working. This is fantastic. Not at all feeling at all remotely awkward about this. Well, it's great to connect with you guys via social media today. Um, Clearly, we're in very unprecedented times with COVID-19, and there's some issues that people have been talking about over the last wee while that we wanted just to catch up about and talk about today, and to give people some up-to-date information, the best information that we've got available from all around the world, and what New Zealand's response to the COVID-19 criteria, the COVID-19 crisis are, and what people can expect in the time to come. Looks like it's working. That's great. Got some comments coming in. G'day, everyone. So I think everyone knows about what COVID-19 is, a novel coronavirus, and we don't have immunity in our community. And this is the largest global pandemic that we've had since the 1918 influenza pandemic. So this is massive. People do not have immunity to this. We've seen what's happened in China, in the Wuhan province. We've seen what's happened in Italy. We've seen what is currently happening in England, and I've been connecting with my friends and colleagues in England over the last couple of days to hear from them about what their experiences have been as well. And of course, it's started to arrive here now as well, with cases even in Dunedin, where I'm based as well. And there's a lot of concern from people who are affected by cancer about coronavirus. Are people at risk of it? What are the risks for people with cancer? How will it affect them? And how might it affect their treatment as well? So I wanted to start by saying that yes, people with cancer are more at risk of getting COVID-19. People with cancer have slightly suppressed immune systems. Now, some more than others. Some people with cancer who are on chemotherapy obviously have suppressed immune systems from their drugs. But even having cancer itself is an immune suppressed state. So cancer does reduce your innate immunity, and that means you're more susceptible to common infections. And given you don't have any memory to coronavirus, then you are more at risk of that. Also, for many people with cancer, they have got other health conditions as well. So people often cancer and other conditions like blood pressure or diabetes or heart disease coexist. And we know that certain conditions, particularly respiratory conditions and blood pressure, high blood pressure, are associated with worse complications of the novel coronavirus, COVID-19. Now, whilst most people recover from COVID, we know that not everyone does, and some people get very sick. And the type of illnesses that people get are primarily respiratory complications, a condition called the adult respiratory distress syndrome, ARDS. And that can lead to other organs in the body, like the kidneys or the heart not working, and the kidneys can shut down, and people can die from that. We know that the risks of severe complications like kidney problems or lung problems increases with the number of comorbidities that you have, and it increases if you are immune suppressed, so like on a cancer treatment, or if you have had cancer treatment recently. Now, those at particular risk of complications are those who are on deeply immune suppressing treatments at the moment. People who've had bone marrow transplants, people who are on deeply immune suppressing drugs, for example. But what's important to be clear is that people at the moment, New Zealand doesn't have community transmission of COVID-19. It's just not there. The people who have got COVID are ones who've had contact with people overseas, have come back home, and that's where they've picked it up. And so we don't have community spread. And so the risk to people with cancer right now, this very minute, is actually very, very, very limited. So what do you need to do if you've got cancer or are on a cancer treatment and are worried about COVID-19? Well, first and foremost, you absolutely and utterly must keep on with your treatment. Stopping your treatment could potentially be harmful, so do not stop the treatment you're on right now. So specialists, oncologists, radiation oncologists, hematologists are making contact with their patients to talk about the exact recommendations for each specific patient as to what you should do personally and what the balance of risks and benefits. But for the overwhelming majority of people right now, the bigger harm is stopping your cancer treatment, so please do carry on. We have got questions coming in. Are people on immune therapy more or less at risk of complications from COVID-19? Now, that's a really tricky one. We don't know a lot about the specific risks and benefits for individual treatments. The amount of information we've actually got is quite small. We've got information which has come out of China, but a lot of the time what's happening is the doctors in Italy and in Britain are so busy fighting this, they haven't had time to sit and analyse the specific risks with particular treatments. Interestingly, there's some data that suggests that having the influenza actually reduces your rate of complications from checkpoint inhibitors, and having the influenza vaccine is actually a good thing to do in people who are on immune therapies like pembrolizumab, Keytruda, nivolumab, Opdivo. And so we're absolutely not suggesting that people who are on immune therapies should be stopping their treatments at all. That's not something which is being recommended. Just being asked, should people have the pneumococcal vaccine? Absolutely. People who have not had their vaccination should get them. There are very few situations whereby people who have cancer should not be vaccinated. There are some specific ones, particularly people with lymphomas or certain blood cancers, or who have had their spleen taken out or inactivated. There are some specific situations where certain vaccines are not a good idea, but for the majority of patients, the overwhelming majority of people affected by cancer, you absolutely should have your vaccine. And the seasonal influenza vaccine now has been brought forward, so people who are affected by cancer would qualify for a subsidised influenza vaccine. And if you've not had your Pneumovax done, that's another good one to get done as well. Would hormone therapy be a risk factor for immune suppression? Actually, no. Hormonal therapies in breast cancer are not particularly immune suppressing. And HER2 drugs like Herceptin, pertuzumab, they are not particularly immune suppressing. So again, people should be continuing on with their treatments at this particular point in time until they've had a chance to meet with their individual specialists. But what can you do? So you're concerned, you're absolutely concerned about your risk of cancer, rightly so, of COVID-19 when you've got cancer. What should you do? Well, for starters, we need to do social distancing. So keeping a couple of metres away. That's why I'm working from home today, because I want to make sure that I'm out of the busiest place with the sickest people at the moment, and I can do my meetings and my conferences today by video. We're moving a lot of our consultations to online, so video consultations and telephone consultations with people are going to become more common, which is a good thing for people who have to travel long distances to see us. So that's a good thing. But there are some people who do still need to be seen face to face. If you've got symptoms of cancer which could be getting worse, or you're worried that your physical symptoms could be your cancer returning, actually seeing your specialist is a really good idea, and they may need to examine you. So a face-to-face consultation may still be the best thing to do. And all doctors and hospitals that treat cancer patients are still going to have facilities to make sure if you need to be seen, you absolutely will be seen by your specialist team. So if you have cancer and you have symptoms, hospital is still the best place for you. It's still the safest place to be. Now, COVID infections, they give the infection, it gives you symptoms of a cough, a fever, and shortness of breath. They are the major symptoms. But there are other conditions as well that can give you fever, cough, and shortness of breath, like pneumonias or other viral infections. And in particular, people who've had chemotherapy, they can have neutropenia, so their immunity can be impaired. Now, if people go, oh, I've got a fever and I'm sitting at home because I've got COVID, so I better socially isolate, then in actual fact, that could be really harmful. And the right thing to do if you've got a fever and you've got cancer and are on treatment is absolutely go to hospital. When you go to hospital, what's going to happen? Well, things will be a little different. Over the next few months, hospitals are going to want to make sure that we look after and take care of our people who have immune suppression and people who've got symptoms of fever. We're going to make sure that they get looked after well, and so they're not contaminated or affected by other people, and that if you do have COVID, that it doesn't get passed to other people too. Overseas, in other countries, what they've done is they've had special entrances for people who've got fevers and respiratory symptoms, or special clinics where staff meet them with special equipment to make sure that the staff health is okay and to make sure that patients' health is okay too. So if you've got symptoms of respiratory infections or fever, call ahead, speak to your cancer centre. Most cancer centres have got an 0800 number of some description that you can contact. and they will tell you exactly where you need to go. It's getting a message from Shami. Hi, Shami. Can MJ get the flu injection? Absolutely he can, and he absolutely must. I hope he's well, and I hope you're well too. I hope you're getting on okay in Queenstown. Really nice to see that you're watching today. What's going to happen over recent times is people's treatments going to be cancelled? Well, no. At the moment, we are in the preparation phase. We are looking forward to the next few months. Just yesterday, of course, the Prime Minister closed the borders to New Zealand, which I think is going to mean that the number of people affected by COVID in New Zealand is going to be very flat for a while, and that's going to save us for some time from a wave of infections. But because no one is immune, and because at some point the borders will reopen, then we will get COVID in New Zealand at some point. If the capacity of the health system, if we have a big peak, like has happened in the UK or in Italy, then health services are compromised and people are not able to have the high standards of care that they're used to expecting. But if all of these social distancing techniques that people are using, the cutting down of the public events, the reduction in the use of public transport, if the scrupulous hand hygiene and the working from home if you can, if people are doing that, then that will mean that fewer people are affected, which means that the health system will be able to cope, which hopefully will mean that people's normal treatments continue as normal. But be sure, the doctors and nurses and the Cancer Agency, of course, as well, is planning carefully for this and working very hard. And I have never, ever seen the health system work so quickly in such a coordinated way as it is in response to this pandemic. What about those of us with children at school? Well, that's a great question. I've got kids at school, and my kids are at school, and schools are so far remaining open. Now, interestingly, COVID infections are not common in children. So they are less common, and children are less likely to get severe complications. We know if we shut the schools before you get COVID infection, well, that's going to have a major impact on the healthcare system, because so many of our fantastic healthcare staff, our nurses, our doctors, our physicists, our radiotherapists, our occupational therapists, our social workers, our reception staff, our cleaners, our orderlies have families and they have kids at school. And if people have to go into isolation because the school's shut down, that will have an impact on the functioning. I was speaking to my friend in London last night who works in a cancer hospital over there, leads the Marsden Hospital. He was saying 10% of their staff are currently off work with infection. So that's really big, 10% of their staff off. But that's because England has had this approach which people have referred to as let it burn, which is just let it run through the community and see what happens. Now, fortunately, they've pulled back on that, and New Zealand's taken a very different approach, which is a containment and stamp it out approach. Been very strong public health measures put in place. And I'm sure you'd all agree that we've never seen such stringent restrictions on public movement as we have right now. What's the best way that we can support our loved ones going through treatment at this time? Well, I think the best way you can support people at the present time is in the same way that you are doing every single day, which is by showing your love and your kindness and compassion, by scrupulous hand washing. And when you do visit, make sure you maintain that social distance. You show them that you care by your hand hygiene, using hand sanitizer or washing your hands with soap. That if you do have the seasonal flu, just a normal old flu or a cough or cold, cough into your elbow like that so that your elbow catches the germs rather than your hands, and wash your hands and keep up good practices like that. Limiting movement so that we don't spread any infection which is in the community as little as possible is important. And making sure that people still get to their treatments and are well looked after. Are people who've had radiotherapy at risk? Absolutely. Some people who have had radiotherapy also are at risk. People who are on radiotherapy, of course, they have cancer. Cancer itself is a risk factor. If you have radiation to certain parts of your body, it can reduce your immunity to a certain extent. So people on radiation are also at risk. But just because you're having cancer treatment doesn't mean you're going to get COVID. And it doesn't mean you're not going to recover from it, but it does mean that you might have more severe complications. So that's why it's important that we look after each other, and we look after each other well, and that we stay well during this time. So yeah, in terms of people are saying that the risks of COVID are worse if you're elderly, and that's very true. So should we keep our kids away from our grandparents and our elders at the moment? Well, at the moment, no. We don't have community spread of COVID. It's not in the schools, it's not in the kids. So no, don't stop your normal family interactions. But do avoid large public gatherings. The current advice is public gatherings of more than 100 people. And the Director General of Health, Ashley Bloomfield, has become a daily staple in all of our news feeds with the updates he's been given, and they're very definitive and very authoritative. The Ministry of Health website is really good, and it gives great updates daily on what the current state of the play is. So I'm just going to wrap up very shortly. We've got another series of teleconferences this afternoon. I'm currently missing one with some of the radiation doctors. I'm going to join back in that one, and then we're going to meet with the blood cancer doctors later on this afternoon. New Zealand is well placed to fight this COVID-19 infection. We are an island nation. We have closed our borders. We've taken some of the strongest measures in the world to fight this epidemic. And although there is going to be community spread at some point, we want to catch it, test it, contain it, stamp it out, and keep our people with cancer and our staff who are looking after the wonderful people who are looking after them at the moment, keep them safe and keep them well and keep our hospitals functioning. Because all the normal stuff needs to happen. People still have to, have their knee surgery. They still have to have their heart surgery, and they still have to have their normal healthcare looking after. So I hope you guys all take care. Really great to see so many people tuning in today. First Facebook Live, quite a nervous event for me. Sorry it took so long to get going, but great, and I'm sure we'll do this again. And during the course of the epidemic, we'll stay in close touch, maybe through this method as well. To talk about what's going on. If you've got time, pop over to the Ministry of Health website and have a look at the Ministry of Health's website for the most up-to-date information. Also, the University of Otago, Dr. Aisha Verrill, who's an infectious disease physician and an epidemiologist, runs a great update as well. She's a real expert on COVID-19 from an infectious disease perspective. But we'll keep everyone up to date about what's going on with people, for people with cancer too. So take care. I look forward to seeing you next time. All I have to do now is work out how to switch it off, which we'll see how that goes. Otherwise, you might end up listening to my teleconference, which will be terribly boring. Bye for now.